Dr. Mike Tildesley joins us. He's a member of the Scientific Pandemic Influenza Group on Modelling, SPIM. You may have seen that acronym in the newspapers. They advise the government on the spread of COVID. Good morning to you, Mike.
Good morning.
Good morning. Do you think the government is being too cautious, or do you think they're being too optimistic from what you're hearing, the mood music from what the Prime Minister has to say?
Well, I mean, it's really difficult because I think, if you look at the data, things are coming down. Obviously cases are coming down, hospital occupancy is coming down, and the deaths are now, still very high, sadly, but are starting to move in the right direction. I think there's always been a little bit of a kind of a yo-yo sort of thing from the government that we lock down and then we sort of go very much from lockdown into relaxing restrictions very quickly. And I think the
very quickly. Where have you been the last year?
Well, I think that's certainly what happened last summer. I think things relaxed probably rather too quickly.
March to July. Are you kidding me?
Well, I think there were many of us who were saying that we shouldn't have relaxed as quickly as we did.
Wait a minute, Mike. Wait a minute. Could you remind me what the death rate was and the infection rate was in the summer after we relaxed?
Well, it was very low, but of course it went back up, and
it went back up. It went back up in mid to late September. We relaxed in July.
Yes, and the messaging very much changed from the government. We very much went from it is your moral duty to stay at home, very much to it is your moral duty to go to the pub.
Yes.
The messaging changed quite dramatically, and this was something that was extremely concerning. I mean, I agree with you. There was a need to relax, but the messaging could have been much better in terms of what that would lead to. And I think
but Mike, I'm sorry. Let's talk about the facts and the data. We came out of lockdown very, very, very slowly last year. We then had an opening up, trying desperately to persuade people to get back out, spend money on the high street. Pubs reopened on the 4th of July, Eat Out to help out in August. At no point during any of those months did we see a rise in infections, hospital admissions or deaths.
Well, we did, actually. I mean, that's simply untrue. I mean, it rose. It may have risen slowly.
Mid-September.
The R number flipped from being below 1 to being greater than 1. This is a fact. And actually, if you look at the data, that's the fact. It may have risen slowly, but it did indeed rise. And this is one of these things that we made very, very clear to the government back at the time. If you flip from lockdown to going out of lockdown, cases will go up.
But hold on a minute. No one, actually I say no one. There are some scary people out there who seem to think we should permanently live underground wearing 18 masks. You go into lockdown, by definition, at some point you're going to have to come out. Even Australia and New Zealand have acknowledged the idea you might actually come out of lockdown at some point. But this is the thing. So at some point you come out of lockdown. When you come out of lockdown, millions of people are locked in their homes. Children aren't at school. People aren't travelling. People aren't allowed to go to shops or pubs. You're going to see a rise in cases. But if the point of the lockdown is to stop the NHS being overwhelmed and people dying because they're unable to get proper health care, there is no chance of the NHS being overwhelmed now, given the absolutely huge fall. We've had more than a 40% fall in the number of people in hospital since the peak. And the hospitals, although they were absolutely under strain, no question at all, and heroic work done by doctors, nurses and others on those COVID wards, there is no chance now of our hospitals being overwhelmed. So why not ease the lockdown restrictions?
Well, I mean, okay, so, you're asking me for my opinion, and I'm trying to explain to you, and the situation is that is simply not true, that there is no chance of the NHS being overwhelmed. So if you think about this, if we go back 12 months ago, the R number was 3. Before we went into any form of lockdown, the R number was about 3. You're saying to me there's no chance of the NHS being overwhelmed. If we were to drop all controls tomorrow, the R number could go up from about just below 1 as it is now. Bear in mind, we now have the new variant, which is more transmissible. The R number could be about 4. Now, even with high levels of vaccination across the vulnerable, it does not protect everybody. So even if 85-90% of people are protected with the vaccination, if your R number goes up by a factor of 4, all of a sudden you're putting an awful lot of people more at risk in that vulnerable group.
Okay, but when you say we relax everything, you're talking about no mask, no social distancing, no hand sanitizer, everyone back in the nightclubs, at the football matches, in the pubs. I mean, I don't think anyone's thinking that we're going to go straight back to that immediately.
Well, you were saying to me there's no chance of overwhelming the NHS, and I'm explaining to you a situation that is simply not true if we relax things too quickly. So, you know,
I know genuinely. I genuinely disagree with you. If you actually look at the people who end up in hospital, okay, well, now we know we've got like people in their 50s and 60s in hospital. If we gave people advice and said, if you are high risk, if you are morbidly obese, if you have major severe breathing problems, if you have not been vaccinated, you should probably still be, not probably, you definitely should be taking extra care with your health. You shouldn't be perhaps in the pub. You should be, I mean, maybe, you know, if your child, your child perhaps should carry on home learning if that's your decision. But the idea that the vast majority of people in this country would be at high risk of being hospitalised, let alone dying, if the R rate did go up, once we've got over 70s now vaccinated, is ridiculous, surely.
Well, I don't think I've said that. I think I was explaining to you the situation of if you completely relax and those vulnerable people. I mean, what you're now suggesting is some kind of targeted shielding.
Well, I've always suggested. I believe in the Great Barrington Declaration is the only moral decision, but targeted voluntary shielding rather than forcible lockdown.
Well, I mean, what you believe or not, I mean, that's perfectly fine. But you were asking for me to explain a situation where, you know, you said that there is no chance of the NHS being overwhelmed, and I'm explaining to you based on the data why it may be possible.
But that's my whole point. Is that your assumption is we release the lockdown restrictions, and then all these people who are 80 years old are suddenly at nightclubs, and all these people who are very high risk in their 50s are suddenly, you know, in the pub at the football. But they won't be. If you give people advice, if you treat people as adults and give people, you know, voluntary advice on what they should be doing given their personal risk of serious disease or death from coronavirus, people are pretty sensible. People take care of themselves any other year. Do you not think that alone would keep the R rate down and stop our health service being overwhelmed?
Well, I mean, I think it's clear that the answer to that is no, because we have seen that, you know, when we relax lockdown, cases go up again. Now, you know, it becomes, you know, I think you're painting me as if I'm someone that wants to stay in lockdown.
No, I'm not at all, Mike.
And all I'm saying is that, yes, I want to get back to normal as much as everybody. But if we take it too rapidly and we don't allow the vaccination to keep pace, then things will go up again. It needs to be very careful easing out. Hopefully so that we can get back to normal, but we can't afford to do it too quickly to avoid exposing these vulnerable people to severe infection, and that's the problem.
Lots of people listening right now who don't have a job which where they're still on their full pay, or who have children who are not getting proper Zoom lessons, not really getting any proper education at all, who are stuck in a tiny little home, lost their job, and really, you know, or lots of people in dire circumstances of their mental health and physical health, they would say we can't afford to carry on with lockdown. Do you think that when your committee, when you're looking at, you know, the modelling and giving advice to the government, do you have to take into account any of the costs of lockdown as opposed to the costs of not locking down? Because the worry is that this cost benefit analysis of, you know, lockdown is seen as like an all good decision, because if it cuts COVID cases, it must be a good thing, even if it actually causes far more damage to far more people.
No, and this is absolutely a point I have made several times in the last 12 months in the media, that we can't just think about COVID. Yeah. We need to think about harm of lockdown. Obviously, as epidemiologists, it's what we think about all the time. But when the government are making the decisions, they need to weigh up damage of COVID to spreading through the population and the damage of lockdown. I think it's an extremely good point that we know that lockdown is damaging. We know it's damaging for education. I've been talking for months about the need to get children back into school and the long-term damage for children in terms of education, in terms of their mental health and well-being. The issue is if we come out too quickly, then and things then go back up again, schools may close again, and that's also damaging.
That would be a political decision.
Absolutely.
There's nothing. These conversations are always couched in the terms of we'd be forced to. No one forces anyone to close the schools.
Absolutely, but we've seen what the government have done in the last 12 months, and this is why exactly, you know, yes, it's not my decision and it shouldn't be my decision, but I'm also aware of what the government may do if cases start to go back up. And I want a situation where our children can go back to school and stay in school, and I think that's extremely important. And if things go up too quickly and they have to yo-yo, then that's hugely damaging, which is why an element of caution for me, knowing what I think the government is likely to do, is probably the best way to get back to normal and stay at a normal level. And
what do you think the government's likely to do?
I think if I think in this situation, I think it's possible that easing may happen a little bit too quickly and things may go back up and we may go in reverse. I hope that's not the case. I really hope by the summer we can be back to normal. I think it's very important for everybody.
Heard that last year.
I mean, you asked me what I think. I'm telling you what I think. And I think if we go too quickly, then we'll end up in a yo-yo situation. And that will be even more damaging for people in terms of mental health and well-being. So, we are in a situation that no strategy is a good strategy. And I think it's very difficult for us as epidemiologists to be getting grief for things that, are out of our hands, and we're trying to advise in the best way we can. And we all, we're all humans as well. We want to go back to normal. We want to be able to see our friends and family, but we want to do it in a way that can be safe and enables us to do that in the long term and not having this yo-yo situation continue.